Joining us right now is Dr. Rob Davidson. He's an emergency room physician in West Michigan. Doctor, thank you for being here. And I looked at many of those protests yesterday and looked from afar and just kept trying to see if I saw a mask among them, because obviously people weren't social distancing. Will this have a long-term effect?
Well, it certainly could, and we won't know for several weeks. However, at a protest I was at last weekend, I would say at least 90% of people were wearing masks, and nearly 100% had masks on them or on their neck and had them on at times. Protests after my shift today that I'm going to go to, that in the invite and on the event, it says, please wear masks. And so, you know, when we look at video I shared on Twitter this morning from a Vegas casino where nobody's wearing masks, and video from Lake of the Ozarks pool where nobody's wearing masks, I think the risk from reopening in states without having adequate testing, without having a president wearing masks in public and modeling that behavior are far greater than what we're seeing in these various locations where people are observing that recommendation.
And Doctor, going back to what we were talking about in terms of Arizona and some of these states that have reopened now for business, but they're still seeing an increase in cases. Experts are worried that there could be a correlation. We know that CDC guidelines recommended that before places reopen, that they would see a several-day decline in case numbers. What do you think is going to happen in those states that are still on the rise?
Yeah, I think this is the big concern. We see case numbers going up in places like Florida, like Texas, North Carolina, South Carolina, you said Arizona. In all of those places, the case positivity rate, the test positivity rate is also going up. And when that happens, that's just a perfect recipe for, we know, 2 weeks from now having increased hospitalizations and ICU hospitalizations and eventually deaths. And we still have a president that is not implementing a national testing strategy, not using the Defense Production Act to get us the tests and the equipment that we need. And I fear that this is a recipe for disaster, this rapid, reckless reopening.
You know, a couple of weeks ago, Dr. Davidson, we saw those people at Lake of the Ozarks, and they were told to go quarantine right afterwards. Should all these people quarantine?
Well, I think people, again, are largely wearing masks. I think people need to be cautious. But, you know, the difference is these people are out battling another public health crisis. In the midst of coronavirus, African Americans are suffering a death rate twice that of the general population. A black man in this country has a 1 in 1,000 chance of being killed by a police officer, 3 to 4 times that of a white man. And so when you have battling public health crises, there was a ProPublica piece by Keila Johnson a few days ago showing that people aren't ignorant going to these protests. They understand the risk, but they also understand the 400-year risk of structural racism.
Yeah, it's why many of those people in Wisconsin stood on lines for hours during the height of the pandemic to vote, knowing the risk. Dr. Rob Davidson joining us from West Michigan. Thank you, Doctor.
Thank you.